Hi, David Liew from Liew 2021 from your laptop for roomnow.com. I just wanted to go through what I thought was a really interesting survey at that was presented, the data for which was presented at Liew 2021. I don't always go through these kind of data, but this was surveying a whole load of European rheumatologists and their RA patients about what treat to target means. And I think that, I don't know about you, but when I'm in the clinic teaching students, teaching trainees, talk about how treat to target, put it on a pedestal, how this has changed modern rheumatology, changed the way we approach the treatment of rheumatoid arthritis, and has changed outcomes for patients. And so I teach that and I say that. And then what happens when the students or the trainees leave the room and I'm left to deal with my patient and myself in an interaction in a busy clinic? Well, in this survey, and may I say, I suspect that perhaps the participants in this survey and perhaps Europeans in general are more diligent about these things than say the average Australian or someone from somewhere else. But looking at it, only 2/3 of doctors and 2/3 of patients, think that they're on a treat to target plan, and doctors only think they do treat to target 2/3 of the time when they break it down patient for patient. In fact, 1/7 of doctors don't believe that they don't apply treat to target at any point. And then the whole idea of treat to target is that we've got a target, right? And that we're going for that target. Well, what about us? What do we think the target is? And the fact is that even though it's allowed under the rules, it's fairly scattergun. In this, most people were looking in this European survey, were looking at a DAS 28 less than 2.6, okay? And that was 75% of people. But if you go down and see it, I mean, you could nominate more than one, but quality of life, reduction in pain, improving quality of life, DAS 28 less than 3.2, so low disease activity. You kind of go through that. I mean, all of them are fairly legitimate, but we don't necessarily have consistency in what we agree is as part of treat to target. And patients want completely different things as well. They're interested in controlling symptoms, reducing pain, slowing joint damage, conducting day-to-day activities, the functionality point of side of view. And I don't think those seem to match up in this survey. But tellingly as well, patients in this who are asked in the survey seem to differ in where they thought the targets were coming from. And I think this probably speaks to the fact that while maybe we've adopted a little bit of treat to target in our lives, that maybe we're not living the true essence of treat to target. And we'll have to decide what that means. Maybe what we're doing is right and we should keep on doing it. And we just need to be more honest with ourselves about what we see as treat to target. And maybe we just need to be a bit more diligent about our treat to target and have the conversations with our patients about shared goals and make sure that we agree with them from the beginning. I know it's made me reflect a little bit more on my practice. And I think it's the kind of conversation that we need to have in general about what are we doing with this core part of rheumatoid arthritis care. So for more great rheumatoid arthritis content from Liew 2021 and across all diseases, in fact, and we've done a lot to try and get content across domains, go to roomnow.com.